Looks like Elisabeth. Take two.
Okay, let's try again. This is about treating knuckle pads with radiotherapy, okay? This is our experience. Here's the co-authors. Amanda is a resident who worked on that, but she couldn't come because residents are not allowed to travel overseas. So this is Jessica Schuster and myself. Here's an example of our patients. Thank you for allowing me to talk about this. All right, let's see whether we can move it forward. Yeah.
So Elisabeth, you can see it down here as well.
We have no conflicts of interest. These are our disclosures. So knuckle pads or Garrod's nodes are associated with Dupuytren's disease or palmar fibromatosis in a good number of patients. And there are varying reports, like from somewhere between 2% up to 50%, and most of them have reported actually in Norway. Patients who have knuckle pads and Dupuytren's disease have often tenderness or pain in their knuckle pads. They sometimes have cosmetic concerns, of course. They have a limited range of motion depending on the size and the other symptoms, and this may limit their daily activities. There's no widely accepted treatment for knuckle pads. Several other methods have been tried, but only in really small series, so here's still a small series. We want to describe the outcome of radiotherapy for knuckle pads. We have 9 patients who were treated since 2012, so not many patients at all up to now. They were all enrolled in a registry protocol, and patients had to go over a questionnaire at the time of the consultation and then again at the time of interview. So what we have are patient-reported outcomes here because patients come from far. They come from here. I work in Virginia, so this is on the East Coast. Patients come from Nebraska or wherever, so they don't come back for follow-up, really. So we called them up. This is an example of how we treat those patients on one of our linear accelerators with electrons. You see a very simple way to position the patients compared to what we saw before. The hands is embedded in bolus material. You see what area we marked for treatment, and then we put also bolus material on top, typically 1 centimeter, but can be also different depending on the individual situation. These 9 patients were all Caucasians, white people, at a median age of 56 years, between 42 and 63. Their symptoms were mostly tenderness, pain, burning, itching, typical symptoms often also seen for Dupuytren's patients. Some reported inability to make a fist, interfering with daily activities such as cooking, gardening, grasping things, or just writing. And 8 of these 9 patients were also treated at the same time for their Dupuytren's disease or Ledderhose disease. We treated the typical dose for Dupuytren's, 30 gray, 10 fractions in split course, 6 to 12 week break in the middle of their treatment. This is a dose distribution. We typically do CT scans actually for our patients for treatment planning because we notice that men and women are different in their thickness, and knuckle pads also can vary quite a bit in the thickness. So here's a typical plan using electrons. In our patients, we use 6 to 12 MeV. We had one patient who had really thick knuckle pads wrapping around the finger, so we used a 12 MeV there. Typically prescribed to 90 to 100% isodose line and use 1 to 1.5 centimeter bolus here. Here are the results. We looked into the size of the knuckle pad, the symptoms, and then just general patient satisfaction with their treatment. And you see here that 7 of the 9 patients had some response or had stable disease. So actually 3 patients reported complete response, 2 some flattening of the knuckle pads, and 2 reported a stable size. 1 had a mixed situation where one hand reported, the other hand did not, showed progression, and then the patient with the largest knuckle pads showed actually progression of the knuckle pads. With regards to symptoms, 8 of the 9 patients reported stable symptoms, and 8 of the 9 reported some response in the symptoms, and 1 patient had stable symptoms. The time since treatment was 9 years, so a quite long time, 3 to 12 years. They had minimal toxicity. 1 patient reported some increased tenderness right after the radiation treatment. Otherwise, no side effects really. Patient satisfaction, 8 of 9 patients. What are our conclusions here? Here's an example. You see a patient at the time of treatment and 12 years later. Really no side effects, also no knuckle pads really. I think we can say from this little study at least that the radiotherapy is safe and effective for treatment of knuckle pads that are symptomatic in patients who also have a diagnosis of Ledderhose or Dupuytren's disease. We saw durable control in most of these patients and think it is we can consider that treatment in the appropriate clinical setting for patients with symptomatic knuckle pads. Thank you.
Thank you, Elisabeth. Other questions from the audience? Yep.
Hi, Elisabeth. Very interesting. Could you comment a little bit about, you had mentioned that there's some patients that also got concurrent treatment for their Dupuytren's and how that treatment was planned in complexity?
Yeah, very good question. Of course, if you treat from the palm as well as from the back of the fingers, there might be overlap depending on the size of the treatment field for the palm. So in these cases, we do CT-guided planning for the electron fields for both fields really to make sure there is no overlap in a typical situation we would have to reduce the dose from the knuckle pad treatment to make sure we have no overdosage there to achieve still 30 gray in this area.
Elisabeth, congratulations. We have a long connection with you that this 30 gray should be remembered for the whole life. As Paul said, so 30 gray given to the knuckle pads here would probably prevent treatment from the inside. So that's why I'm more hesitant to treat knuckle pads, because I expect in the future more having the disease on the inside. And so I reduce my indication for knuckle pads because I don't want to interfere with a possible dose I need for the inside. That is a conflict of interest with the patient because I have to tell him you have a disease for your life and be prevented for the situation you would need it from the inside. Right. I don't want to give 45 gray in this dose to one finger joint.
Yes. No, thank you again. Similar comment. So we really make sure that there is no overdosage. And the dose, as I showed you in the dose distribution here based on the CT scan, the dose, if we treat knuckle pads to the palm side of the skin, is really less than 15 gray in that situation. So that would still allow us to give, a effective dose if we need to treat at a later time for Dupuytren's disease from the palmar side.
Thank you.